are there any particular types of misinformation? Are there any particular conspiracy theories that worry you most, or is this just a matter of the overall degree and intensity of this type of misinformation? Dr. Harris, maybe we could start with you.
Great, and thank you, and thank you for raising this talk. You know, I have said to many that I spent the first 2 weeks of this pandemic really not in my role as president of the AMA, but as a friend and a family member, dispelling the myth that African Americans could not become infected. And so clearly misinformation and disinformation abounds now, but let's also not forget, pre-COVID-19, there was a lot of misinformation and disinformation out there, which is why the AMA has been working really hard to make sure that we are a credible and trusted source of information. I gave an address in November about trust. And that holds true today, and certainly all of the rumors. You know, science has been under attack now for over a decade, and social media has amplified the 5G conspiracy and Dr. Anthony Fauci. And these are very troubling, and that's why we, all of us who believe in science and who have science as our guide, have to step up and make sure we rebut the misinformation and the disinformation.
David, can I turn to you?
Definitely, and again, thank you for having us. You know, I agree with Dr. Harris's comments. I would also say that I think one of the most pernicious dimensions of misinformation is the things that are true, but when expressed become misunderstood and misinterpreted. And Dr. Harris mentioned the effect of the virus on African Americans. I'd say the effect on children is a great example of this. Is that a lot of people look at the data, and the data is real hard data that says fewer children are getting this disease and suffering ill effects from the disease. And they interpret from that incorrectly that means children can continue to do what they want to do. We might as well keep the schools open. And to Dr. Harris's point, the science doesn't say that. The science says, yes, the effect may be different. But in terms of the overall, society-wide population dynamic, we have to treat children and adults similarly from a physical distancing standpoint.
Yeah. No, I think you both make a really terrific point. There are these strains of misinformation that cause people to go out and put themselves in harm's way, potentially in harm's way, and perhaps to endanger others. This is also what's been worrying me. And, sometimes I think about, there's the president obviously suggesting on national television that it might be safe and advisable to drink disinfectant. But in some ways, I almost worry more about a local deli owner in New York City who told me early in the pandemic when I went in looking for hand sanitizer, I'm sorry, we're out, but don't worry, just wash your hands in vodka. These things that people think will safeguard them and protect them, and in fact don't at all, seem to be really one of the most troublesome categories of misinformation.
And if I could add, because we do have a challenge, and I think we have to figure this out. The information, the science, and the data is evolving, right? And even among the scientists and us who are well informed. And so the challenge is how we communicate that to the public that yes, yesterday there was a different set of information that was factual and evidence-based at the time, but now we have new information, and that has to be frustrating. But one way that I have been trying to explain that, of course, is something that my grandmother used to say to me. And she used to say, when you know better, you do better. And that's one way I've been trying to distill down the fact that, yes, we will receive and hear about and talk about evolving information. And that's the expectation. And it doesn't mean that people have been dishonest yesterday or in the past.
Mm-hmm.
I'd build on that by saying that, we've published probably about 500 pieces of content that have reached around 55 million people since the beginning of March. And we've had to invest a massive amount of time, money, and resource in keeping that content up to date. And that is one of the things that, when you think about that dynamic, we are a health-focused site with very high standards, and the financial wherewithal to we literally have probably 50 people working on that content, and we can do that. But there are a lot of folks who can't do that and see an opportunity to make a buck from jumping on a trend on social media that is going to generate a lot of traffic for them. They think they're doing good, but to Dr. Harris's point, that they don't get to the level of detail. I'd share an anecdote that somebody wrote into us talking about their uncle, how their uncle had died of COVID because he'd not understood that having an upset stomach is actually a side effect of COVID. And had he understood that, he would have gone to the hospital. And pointed out that there is content out there. Our sites, both healthline.com and Medical News, they publish content that's thorough and covers that. But that thoroughness comes at a very high cost. And that is literally financial cost. And that is, I think, a lot of why it is as big a problem as it is. It's not as simple as I think it might appear at first blush to produce really high quality, fact-based, evidence-based content.
Oh, sure. I know that story well.
You know it better than most.
You hit it's a great point. It's in such a fluid and rapidly evolving story where so little is is understood, at the outset. It's very challenging. But this is a good moment then to pivot to another one of my questions. So when it comes to efforts to dispel misinformation and combat some of these conspiracies, which I agree wholeheartedly, as both of you said, is something we all have a responsibility to do. What is the best way to do that? And in particular, where do we focus our gaze? Again, you have so many actors. You have, as I've mentioned, the White House. But you also have the media. Even those that are well-intentioned, like you say. You also have just individuals, getting together in places like Facebook and other online forums. Where do we begin, and what are the best practices?
So certainly the AMA is called on tech platforms and the media and politicians and everyone to make sure that they are putting out credible sources of information. But it's maybe like playing whack-a-mole, and we still need to do that. We still need to call it out when we see it. But I think you have to start internally, right? So of course trust is earned, and since you can control what you do, what your particular organization does, you should then strive to be a source of credible information, to tell people that what you knew yesterday may be changed, to be transparent, and then earn that trust, and then people will come to you. Of course, not everyone, and you won't be able to again control all the other entities out there, but you can control whether or not you are a trusted source of information, and then people will then come to you and know and begin to trust that the information that you put out is reliable, accurate, transparent.
Curtis, I think this is such a great question because it is it's a multi-front challenge, right? That we as human beings rely on so many different sources of information, and this is not a problem that can be solved centrally because of that, right? Like, there are a series of or there's an entire set of different problems that we have to solve. There's sort of a different approach that I think gives me hope, which is that we as consumers of that information, whether we are a citizen listening to our president, we are an individual reading a health site, an individual doing, spending time on social media, we all have judgment, and we have to improve that judgment. That's really, to me, the best solution to that problem. And I'm encouraged because I know I have 4 children. And even in elementary school now, they're being taught to judge the worthiness of a source. And I think we as parents, as peers, we need to make that an important part of our kind of day-to-day commitment to truth. Is it's not just exercise our own judgment, but really develop judgment in everyone around us. So in addition to everything Dr. Harris says about kind of the work that we do, certainly should be subject to that high judgment. But I think as human beings and parents and citizens, we need to really double down on our sense of judgment.
The debunking approach, you know, kind of going out and trying to fight every fight and quash every rumor often backfires. That doing instead what both of you seem to be suggesting, taking a more proactive strategy toward creating trust and educating people is really the way to go. But I do wonder, there are moments, right, when we need to stand up and say, no, this is not true. Can you talk a little bit about kind of how we pick those types of battles?
So I can give you a very specific example of it. We, on our website, Medical News Today, one of our top performing articles is essentially a list of coronavirus myths that are debunked. We've probably reached a couple million people on it. And the dynamic behind that is putting good, solid, evidence-based content in front of a Google search engine actually gets you a reward. It gets you a lot of visitors and traffic, and ultimately some revenue and monetization. And so I think that's one of the things that you know, whether we in general love or hate Google, you know, they have created pretty clear rules around how you actually get to the top of search results, and thankfully, kind of having fact-based, evidence-based, authoritative content is a big part of how you do that.
Okay.
I agree, and that's I'm very glad to know that. But you do, you know, have to at some point say no, that's a bridge too far. And I think it may depend on the timing of the information and you know, the dangerousness of the information. You may have seen my comment, which was pretty strong. I mean, I think we should all be measured and neutral, and again, science-based and evidence-based, because again, you can have your own opinion, but not your own fact. And so I've worked really hard to do that, but I really made a strong, some people may not think that, but strong statement regarding hydroxychloroquine. And really, I think we need to do that for, you know, all of these. You know, I think people are searching, everyone is searching for good news, that everyone latches on to these very early studies. And so then they get, I think, elevated before, you know, if it were contained within the scientific community, that's appropriate and something we've always done. But we have to be even more careful right now. And certainly my concern was, you know, something that we do every day as physicians. We prescribe a medication and we talk about the mundane, routine, probably not very dangerous risk, but we also talk about the rare, but very dangerous, life-threatening risk. And I felt like it was important to raise that issue, and of course around you know, the disinfectant and ingesting disinfectant, because we did see some poison control calls right after that. So I think you know, you have to make those decisions, but certainly the dangerousness impact, if you will, certainly makes a difference as to what you decide to debunk.
Absolutely, and certainly we appreciate the efforts of the AMA, Healthline, and others. I mean, everybody who's trying to sort truth from fiction in this time. Unfortunately, we are out of time, but Dr. Harris, Scott, I want to thank you so much for joining us today. This has really been a fantastic discussion, and I think you know, a really important one. I'm sure we could go on talking about this for quite some time, but I just want to close in saying that I do hope that you know, reason and expertise in science will rule the day rather than emotion and fear. Thanks again. All right.
Thank you.
Thank you, Curtis.